After cervical disc and thoracic disc endoscopic surgery, we have to classify it as one portal or biportal, or it is third-generation endoscopy. Under the name of the endoscopic procedure, grounding spinal bone, removing disc, and breaking down the joint. Commonly, they said it is an endoscopic procedure, but it is an actual open surgery. The United States, Japan, and Europe are all the same. Of course, Korea is same with them. As Wooridul Spine Hospital, endoscopy is true endoscopy, which is the reason it is called an endoscopic procedure, not a surgery. The surgery means to break the spina bone and grind the cervical and thoracic bone. When you get the endoscopic procedure at the cervical or lumbar disc, the most important thing is to preserve the spinal bone and act as a cushion without destroying the disc, and maintain its height. Precision removal of the lesion which is compressing the nerve. I would like to say that is real endoscopy. We can call it the third-generation endoscopy. Not all endoscopic surgeries are the same. Endoscopy in the United States, in Japan, and in general hospitals have the same name, but they are all different, so you need to check what kind of endoscopic procedure it is. Many people are curious about how often recurrence occurs and how many after effects occur after an endoscopic procedure. First, let me tell you about the recurrence rate after open surgery. What do you mean by incision? It means making a straight cut with a knife under general anesthesia. Incisional surgery has a high recurrence rate. It's 15%, but it has been reported as high as 15 to 20%. That means 10%, 20% are recurrenced. The open surgery's sequelae ratio is 15%. Some doctors reported as it 25%. That means only 75% fine after open surgery. However, to rephrase, it means that 15% to 25% experience sequela. What are the sequela and recurrence rates of endoscopy? It's only 4%. So, how did this 4% ratio came out? Wooridul Spine Hospital analyzed and studied patients who did endoscopic procedures, over 10,000. After making individual phone calls, conducting one-by-one surveys, and tracking tests the patients who had the third endoscopic procedure at our hospital, the recurrence rate is only 4%. This 4% for recurrence rate too lower than 15% for open surgery's recurrence rate. There is other good news for the patient who had recurrence. In case after open surgery occurred recurrence, this is not recovered by itself. That requires undergoing fundamental treatment once again. However, when the patient who underwent the endoscopic procedure experienced a recurrence, there are lots of cases with recovery by itself. Someone treated a cervical herniated disc through endoscopic and then fully recovered. Suddenly recurrence 2 weeks later, or recurrence after 1 month later, or recurrence after 6 weeks later. We do not recommend surgery again. In many cases, injections, medication therapy, and physical therapy recovers by itself. It's an amazing fact discovered by Wooridul Spine Hospital. You can see that 4% of people who were cured with endoscopy have a recurrence and do not need surgery, and it is absorbed on its own. When the disc is rupturing, what comes out? In common terms, people often say that the end plate has slipped out. That is true. When the early stage of rupture disc, it does not slip out like jelly things, its end plate comes out along with it. In the MRI, it appears as a dark line. Even in CT scans, you can see that the end plate is clearly in white. This is when a piece comes out and herniated, because this is the end plate. Can't easily absorb. It takes a long time to absorb it, so takes longer than 6 months more for absorb. There was the patient who was diagnosed with a herniated disc that took 10 years more to absorb by themselves. But our causal treatment is to recover immediately. You get better on the same day. After the endoscopic procedure, recovered on the site. The patients who are immediately cured in the surgery room is 75% because the anesthesia not administered. Patient quickly aware. Patients express their feeling in the surgery room. The remaining 21% recover within 1 to 2 weeks. Some patient had fully recovered after 6 weeks later. Usually, 1 to 2 weeks later. they are all recovered. When endoscopic surgery recurs, what protrudes is not an end plate, that is the soft spinal fluid. During the endoscopic procedure, we already made a small hole. When there's a recurrence, it tries to get out of there without pressing on the nerve. So it comes out the other side of the nerve. Because it's a squishy, jelly-like fluid that's leaking out, it is absorbed naturally. As a result, individuals who experience a recurrence after undergoing endoscopic neck, back or lumbar procedure have a high likelihood of healing naturally without requiring immediate surgery. There is hope that the condition will heal on its own. Of course, you'll need to take medication, physical therapy, and receive pain injections to keep you pain-free.